everyone. Welcome to this exciting webinar tonight on ovarian rejuvenation, facts and myths. I'm so excited to be here with you this evening. After 25 years in the medical field, I finally feel the fulfillment of being able to take part in a truly helping make a difference in people's lives. After many years in sperm specialty and studying fertility with many great reproductive endocrinologists, it was not until I found Dr. Wood and under his guidance and direction, I could fully understand that fertility treatment is not a one-size-fits-all. And thanks to his great research and scientific studies, we can sit here tonight and discuss the amazing advancements in technology and individual treatments that we can provide for you here at Gen 5 Fertility. So before we get started with some of the facts and myths and questions that are common and that you're going to have later on at the end of the discussion, I just wanted to give a brief overview of ovarian rejuvenation for some that haven't attended the webinars previously. So we'll go over that first, and then we'll get into some of the questions. One success story that I really am excited to share with you, though, although we've had many get pregnant after ovarian rejuvenation with fertility treatment, last year alone, we had 6 patients that got pregnant just on their own spontaneously after the ovarian rejuvenation injection. And one of them was a 43-year-old who had tried to conceive for many years. She'd even gone through 6 failed IVF cycles elsewhere. And after she had done ovarian rejuvenation with Dr. Wood, she spontaneously conceived, and she's in her 3rd trimester now. So that was just one of the amazing stories that I wanted to be able to share with you tonight. So what is ovarian rejuvenation? Well, it's used to improve poor human ovarian function and ovarian insufficiency resulting from ovarian aging. Now, not just chronological aging, but this can affect all women, whether it's early menopause, premature ovarian insufficiency, or ovarian failure. Here at Gen 5, we do have 5 different generations. Most importantly, that I always like to tell patients during consultation is there isn't necessarily one that's better than the other, but again, they're all meant to fit each individual differently. So after Dr. Wood goes over with you your medical history and fertility history, he's going to help you determine which one is going to help you have the best success. So they're designed to further increase the concentration of growth factors you'll receive from your activated platelets. And each of these procedures are designed for specific patients. You might have more than one option that Dr. Wood might be able to offer you based on your fertility history. One of the options that I just wanted to be sure to let you know about tonight, it's one of our newer ones, Generation R. Now, this is for very low probability cases of patients who have been sent away elsewhere or told that they have no chances. Now, this is always evolving, very innovative in medicine. It will use some studies that we have seen in animal studies that have helped improve ovarian function. And so this is constantly changing as far as the treatments. Right now, part of it does involve NAD, which we'll talk about a little bit later, as a coenzyme that's naturally found in our body. And as we age, we lose that. And it is what's responsible for cell rejuvenation in our body. So that's one of the important factors that helped Dr. Wood in inventing Generation R. Now, if you do already come to us and has some ovarian activity, then you will probably be able to fit one of the 4 generations of ovarian rejuvenation, which are the injections into the ovaries. Now, ovarian rejuvenation may improve the function by stimulating ovarian cells that develop into eggs. Because the PRP and enriched platelet factor infusion involve the use of your own platelets rather than donor platelets, there's no risk of cell rejection or graft versus host reaction. And that's one of the common questions that does get asked is, what are the side effects? So this eliminates side effects because we're using your own blood source. Now, all involve carefully inserting cytokines and chemokines and other growth factors into ovarian tissue. And these can be thought of as molecular signals that activate cell growth and angiogenesis, which is blood vessel growth, and improve blood flow. These changes are thought to improve oocyte number and quality. So I promise you, I'll try not to get more scientific than that tonight, but we can discuss more later. Now, reproduction and menopause symptoms. These are both factors that patients come to us for ovarian rejuvenation. It does not have to be for just one or the other, but we treat both of those. Now, with menopause symptoms, that really does involve someone's quality of life. We have patients that come to us yearly to do it as maintenance for menopausal symptoms. Even some patients who maybe have already gone to using donor eggs or using a gestational carrier like to do ovarian rejuvenation because a lot of them tell us that it improves their energy and they just feel better in preparing for the birth of the baby. So some of the benefits that have been proven to help is improve sexual function, sleep quality, cervical mucus production, energy level, scalp hair growth, and skin appearance. And again, this is ever evolving. Last year, we had 3 patients who came to us who said they experienced anxiety with their menopause. So they actually felt relief of that. So we're learning as we're continuing to evolve with ovarian rejuvenation, the more benefits that it can help with many. Now, just getting into some of the questions that are common. We're going to get to some of the questions that you send shortly, and we'll try our very best to get to as many as we can. If we're not able to get to all of you, please feel free to use your voucher for the one-on-one consultations, and we'd be happy to be more individualized in answering some of your detailed questions about your own medical history. Now, going back to our last slide that we just talked about, can ovarian rejuvenation reverse menopause and improve ovarian function? Yes, it can. So very important is with those menopause factors that we just discussed, it can help symptoms. Now, again, it depends on each individual, some of the factors that it can help. For example, some patients do come to us with not having periods for a long time, and they want to get regular with their periods or menses. And it might not actually help them achieve a period again, but it can still help symptoms. Now, some, though, it can help them be regular again. So again, it's not always just on ovarian rejuvenation, what specifically helps all encompassing, but each individual can experience different benefits. Is ovarian rejuvenation a miracle cure for fertility? So unfortunately, it's not, but I do believe that Dr. Wood carries fairy dust in his pocket sometimes because we have seen many miracles happen here. And the good benefits that can happen with ovarian rejuvenation can also be harmed with how treatment is done later. So we have seen in some cases where patients will come to us for ovarian rejuvenation, have wonderful results with follicles, but then perhaps wherever they're having IVF, if the protocol is not good for that patient, then it's not going to be a miracle cure, so to speak. So it's very important that Dr. Wood also, not just in ovarian rejuvenation, and we're not going to talk too much about IVF, but I just wanted to comment that with the IVF, it's very important how that protocol is done. And he specifically specializes in women over 42 years of age. So it's not a one size fits all or ABC protocol. Everyone is different. So many might not need as much medication, for example, as some younger individuals might need. So this is just kind of expanding on that question of a miracle cure. So all of your treatment is all encompassing and important as you're trying to achieve, whether it's pregnancy or menopause relief. At what age can I do ovarian rejuvenation? So the age is largely vast. Dr. Wood has had patients as young as 16 who have needed ovarian rejuvenation, 19, 21, well into the late 50s. Now, the reasons for each individual that are doing it is different. As younger individuals start missing periods or going a long time without periods, this is what is usually considered POI, premature ovarian insufficiency. And it's very important, this is very dear to my heart, that these patients get help as soon as possible. And, a lot of times it's dismissed when they're younger because, it's not something they need to worry about. But sometimes we can see patients that are too late and have gone too many decades without periods or premature ovarian insufficiency. So it's very important to let our loved ones know as soon as possible to seek help. So with these younger patients, a lot of them already have undetectable AMH. And so it's important that they have the treatment. And even though, of course, at a young age, they don't know if they want children in the future, but they can try and freeze their eggs so that if they do decide, then it's not too late for them when they come at an older reproductive age. Can ovarian rejuvenation be done if I have irregular periods or no periods? So yes, again, this all kind of encompasses what we've been talking about. Many patients, whether it's due to menopause or whether it's due to having POI or POF, which is premature ovarian insufficiency and premature ovarian failure, need treatment of ovarian rejuvenation to help them. And so it can be done in either case. Now, again, Dr. Wood will talk to you about your chances and how long it's been and a little bit about your medical history to further help you in making the best decision to treat your particular situation. So some common questions that we get: how long does it take to work? Well, again, we don't have the exact answer for that. Every individual is different, but we do recommend that you give it at least 4 weeks before retesting to see how your hormones compare to your baseline testing that we do before the procedure. That 4 weeks gives a chance for your cell rejuvenation to take place. So it's especially when it comes to reproduction, it's not going to help the eggs that are already developed, but those future cells and eggs that develop. So at least giving it a chance, those few weeks for it to set in. Now, some patients, though, who have gone many years without periods or with POI situations like that, it can take several months sometimes for their body to respond if they still have eggs left. What is the recovery time for the procedure? So it's very little recovery time. What is great is you're here for about half a day for the procedure. After the injection, you rest for about 20 minutes, and then you're good to go after that. You could go have a nice little vacation at the beach or travel home that same afternoon. The only restrictions usually that are requested for the 24 hours is no intercourse, no strenuous activity, and no soaking in any water like baths or pools or things like that. So that restriction is just about 24 hours. But of course, you're going to listen to your body. If you're still experiencing a little cramping, just take it easy. Does it have to be repeated, or can it be repeated? So yes, it can be repeated. Again, going back to some patients who do this for menopause and for maintenance, repeated every year. It depends, on the patient. Sometimes the benefits of their symptoms last for about 6 months. I think the longest we've seen is 2 years, but on average for menopause, it's about 6 months to a year. Again, everybody's body is a little bit different. So if you're doing it for maintenance, you could repeat it. Now, does it have to be repeated? I feel like that's more of a question when it comes to reproduction. So it depends on what your goals are. And Dr. Wood and I will help you decide that based on, perhaps how many children you want to have, or if you're just freezing eggs, how many eggs you want frozen. Sometimes if you have a low egg reserve and you only get a few eggs each month, then you might want to repeat it after several months so that you could attain more eggs to freeze or embryos to create. Do I have to do IVF, or can I try on my own to get pregnant? So yes, you can try on your own. Of course, we don't make any patient do anything that they don't want to do. So you can definitely try on your own. But one thing to remember is a large majority of our patients come to us already with low probability and already lower egg reserve. So in most cases, it is recommended that you pursue IVF for your best chances of reproduction. Can it be combined with other fertility treatments? So Dr. Wood will let you know what treatments, perhaps that you're pursuing. There's so many things out there that people are constantly asking us. A lot of common ones, of course, are acupuncture or NAD IV therapy, which are great in supporting ovarian rejuvenation and fertility treatments. There are some newer things that patients ask about, for example, red light therapy, ozone therapy. So one thing that Dr. Wood always goes back to is, what is the proven research? What are the proven studies? So we can't recommend anything that doesn't have already that research and study. So although they might be good or they might not be harmful, we're going to be discussing that later on in another webinar that Dr. Wood is going to do about all of the resources out there for new treatments out. What other lifestyle changes can improve ovarian rejuvenation? In 2 words, nothing extreme. So we have sometimes patients that come to us that say they've tried for a year of no carbs or no fat, but nothing extreme is good. You want to be sure to have a well-balanced diet, and it actually can be harmful in fertility to restrict yourself one extreme to the other. So well-balanced, nutritious, vitamin-enriched diet is important. And then, of course, also, Dr. Wood will talk to you about medications that might need to be added to improve ovarian rejuvenation effects or pursuing reproduction. So in conclusion, our main goal here at Gen 5 Fertility is to treat each client the way that they deserve to be treated, and to treat each client the way that we as fertility experts would want to be treated. So when you walk through the door, we hope that you feel the support and hope and chances that we want to offer you. That was all for the discussion tonight on the ovarian rejuvenation, but we'll go into a little bit about your questions here. So a few of them I'm just going to go through here. And again, I'm so sorry if we can't get to all of you due to timing and such. We're going to try our best. Again, feel free to set up a consultation so that we can better assist your individual needs. One of the questions is this procedure okay for women in their 40s? Again, large age range. It is safe to do that. And depending on the reasons why, reproduction, menopause will help you determine if the success can be something that can be achieved. Does it guarantee pregnancy? Well, unfortunately, we can't guarantee that because everybody's body reacts differently. And of course, we know that women are born with their eggs for their lifetime. And as we age, we do lose them. And unfortunately, we can't make eggs for women. Although Dr. Wood reminds me one day that we will be able to, hopefully in the next decade. So join us for that webinar in 10 years. But we can try the best we can to help you out in achieving your goals. This is a common question that we do get asked. I see it here several times. What percentage of success has this process shown? Now, remember, success can be very subjective, and it also depends on each individual, where your fertility status is. We can't compare or take statistics of a whole group of, okay, this is 140-year-olds, because all those 40-year-olds are different. Their environment, their lifestyle, and their pregnancy, their fertility history, their medical problems, things like that. So it is very different for each individual. And there might be some patients that respond better at 45 years old than some 35-year-olds do. So again, we cannot group that into a certain category. Does ovarian rejuvenation increase egg quality as well as quantity? So yes, that's just when we went back to the slide about the growth factors and how it helps the ovarian function and activity. Again, as far as the quantity, we can't make eggs for patients, but in some cases, it can improve their follicle growth. And depending on the IVF protocol and where they complete that, it can also help sometimes those follicles grow in a better way. Where sometimes with medications, it can shut down follicle growth or the receptors around the follicles. So patients might start out with 10 follicles, but at egg retrieval, perhaps they have only 3 eggs retrieved. That's a common instance that we hear from patients that come to us from other fertility centers. So that's why it's very important after ovarian rejuvenation, Dr. Wood will fine-tune your IVF cycle so that you can have the most eggs possible at your retrieval. A patient mentioned that they had had a round of PRP at another center and did not have any success afterwards. So again, this is very common. PRP is generation 1 that's been around for a long time. And unfortunately, it can be great for helping menopause symptoms, but not so much when it comes to reproduction. So we do tend to see patients from other centers who've done PRP before, and they're able, fortunately, to come to us to have the more advanced ovarian generations, such as generation 2, 3, or 4, that include growth factors also to have more success when it comes to reproduction. What are the available options for patients that live in another state? So we are an international center. We have patients that come from all over the world and many from other states. For the ovarian rejuvenation, you do have to be here for about half a day. And most patients that are out of state, of course, have to come the night before. And you're able to fly home that same day. So if you don't want to stay in sunny San Diego, if you do, we'll write you a prescription for a month's stay, but you can just stay for half a day and leave. And then we can help you with outside monitoring is the term, where we can send orders for you to have testing done near you at your follow-ups and even through the IVF cycle. And then again, you would just fly here for the egg retrieval time. So a lot of times you only have to be here about 2 or 3 times while you're trying to pursue either freezing, storing embryos or storing eggs or pursuing pregnancy. Okay, let me look at these other questions here. Sorry, there's 2 places. Oh, I love this one. How old, because I did forget to mention it during the webinar, but how old is your oldest patient for fertility? So our oldest patient to get pregnant with her own eggs was 47. The oldest in the world with fertility treatment was a 48-year-old. And that is because fertility centers have to document that. So with documentation, there was a 48-year-old and we've had a 47-year-old. It does become more difficult, of course, as our chronological age, but someone had to be the first 46-year-old, someone had to be the first 47-year-old. So you never know in the future. But for most cases, we can still do the ovarian rejuvenation. After the age of 49, it is only recommended for menopause symptoms because that is the age that has been proven where eggs have been able to be retrieved, where it led to a pregnancy at 48. So after that, it's usually for menopause symptoms. I have POI, and I was wondering if I need hormone replacement while going through ovarian rejuvenation. So a lot of times at the beginning, patients will need some progesterone and estrogen. We will do some kind of pre-treatment with them before ovarian rejuvenation and sometimes afterwards until the ovarian rejuvenation starts to help the cell regeneration and help the development of, or I should say, the balance of your hormones. So sometimes POI patients, well, I shouldn't say sometimes, in most cases, the FSH is very high, and that does need to be controlled. So ovarian rejuvenation helps with that, but at the beginning stages, we will usually suggest some kind of pre-treatment to help it advance that way. When deciding between generation 2 or 3, is it better to get generation 2 or 3? Okay, is the question. Sorry, I had to read the question. So generation 2 and 3, the main thing with those is they all have growth factors. Okay, those generation 2, 3, and 4. The only difference is growth factors have a great boost, but alone, we see that it's shorter lived on a graph. Whereas when you add the platelet-rich plasma to the growth factors, even though, again, PRP alone doesn't help reproduction as much, when you add it to the growth factors, it helps extend the life of it. So really the main difference between generation 2 and 3, which is a common question in deciding, is that 2 lasts on average about 3 to 4 months with patients, whereas 3 lasts about 6 or 7 months. The benefits for patients is what we're talking about. So depending on a lot of times when I'm helping patients decide after they discuss with Dr. Wood these 2 options is perhaps if you have a very high egg reserve and your issue maybe has just been with poor egg quality or having miscarriages, then you just might need that short boost for a couple months with generation 2. Whereas generation 3, when you have a lower egg reserve, sometimes it helps because that one lasts longer. So again, you won't be all of a sudden producing 20 or 100 eggs. You'll still be getting a lower amount of eggs if you have a low egg reserve, but it gives it more time to last. So perhaps you might need 1, 2, or 3 IVF cycles to achieve enough embryos that you want stored. When in the cycle is best to do ovarian rejuvenation? So usually the best time is between cycle day 2 through 8. So cycle day 1 is when your period or menses starts, when you start your bleeding. And we usually do the procedure between 2 and 8. Now, the only factor with this is that that is the protocol for someone who has regular monthly periods. Now, if you're someone who maybe goes several months without periods or hasn't had them in a long time, then it could be done at any time of the month and in any time of the cycle. Am I awake during the procedure? So yes, you are. We have found that most patients tolerate it just fine, even though it takes us several hours to prepare in the lab. The actual injection by Dr. Wood only is about 30 seconds on each side. It's a very small needle, and I've had a lot of patients tell me they don't even feel the needle. Sometimes if they experience anything, it's from some cramping when their ovaries are filling up with fluid. Similar, the description that patients usually give me is it's similar to ovulating, like when your ovaries start to cramp. And so we give you a heating pack for your stomach. You can have some extra strength Tylenol, and usually after you lay down for 20 minutes after the injection, those symptoms usually subside. The only patients that we've seen really need to have anesthesia in some cases for this procedure is perhaps ones who have never had intercourse before, so they aren't able to even handle the vaginal probe for an ultrasound. Do I have a few more minutes for a couple more questions? Okay, we'll try to take a couple more questions here so we don't take your whole evening and you could get to dinner. A patient asked they'd like to get pregnant for the first time. Is ovarian rejuvenation an option for them? Yes, it is an option. Of course, it doesn't matter if you've ever been pregnant or if you've had several pregnancies. Really, it's just determine if it's a need or not, depending on your medical history, your fertility history, and things that we would check during your consultation with Dr. Wood. So we can help you determine if ovarian rejuvenation might be a factor for you, or if you're someone who can just go straight to an IVF cycle, or perhaps even an IUI insemination cycle, if that's doable in your case. Huh? 3 more? Okay, perfect. Can you give more info about NAD therapy? Do you do it at your center? So yes, we do. That is done mainly with our Generation 4 and our Generation R treatment. So we do recommend the precursor, the oral tablets of NMN, which if you looked at our site, you might be familiar of that with Dr. Wood. We recommend that all of our patients pursuing menopause relief or reproduction get on that oral supplementation. But of course, some of it is lost during absorption and stuff. So we do encourage NAD IV therapy. Some patients get it monthly. When you do Generation 4, it is given while you're here waiting for the procedure. And we also can offer it a la carte. If you just want to come in for the IV while you're pursuing your IVF with us, you can definitely do that too. Now, a little bit more about NAD therapy. NAD plus is NAD, like we had mentioned earlier, is a coenzyme naturally found in our body. As we age, we lose it. It's what's responsible for cell rejuvenation. For everything, you might see that there's a lot of walk-in clinics that are offering it. People do it for memory loss, for muscle recovery. Well, there was a study done because of Dr. Wood's great research and advancement. There was a study that he always mentions that is where NAD improved the quality of follicles and eggs in mice, and mice have similar eggs as humans. So that study was very important. When you have a consultation with us, we could always forward you that study and that paperwork on it. Okay, sorry, I'm going through a few of these questions were our repeat questions, so that's great. Hopefully a lot of you got your questions answered. Someone asked what is considered a very high FSH. So of course, when our reproduction and our egg reserve is normal when we're younger, it was usually less than 10, because you don't need much FSH in order for our follicles to stimulate when you have such a large egg reserve. But as we age and as our egg reserve goes down, that FSH starts to overwork, and it gets higher and higher. So of course, after it gets past 15, 25, then that's where you should start to be concerned. Pursuing ovarian rejuvenation can help that, or further treatments. Now, Dr. Wood has helped people and been able to reverse FSH even well into the hundreds. But you cannot help eggs develop or follicles develop when FSH is over 25. So it will stop that development. So it's very important to keep it controlled in order to have the best success in going forward. And so that's a little bit a part of what we do for the IVF cycle also, is continuing to check your FSH throughout your IVF cycle also. So I think that's all for this evening, but I hope you enjoyed a little informative webinar on ovarian rejuvenation. We hope that your questions were answered. Feel free to call in, set up a consultation so that we can help you more. And we hope to see you one day here at Gen 5 Fertility. Thank you all and have a good evening.